So my topic for today is to go over the Tibetan Medical Institute, Men-Tsee-Khang, which is the largest institute for Sowa Rigpa, which is a traditional Tibetan medicine. Here's a disclosure. And I'd like to go over some history and information about Tibet and the Dalai Lama, which led to a collaboration between Emory University School of Medicine in Atlanta and Men-Tsee-Khang in India. This is a Tibetan Medical Institute in India, two institutions which teach very different types of medicine. And I'd like to focus on some of the principles that we learned about Tibetan medicine itself through this exchange, and also woven in this discussion to give you a feel for this trip to Men-Tsee-Khang for teaching exchange. And the institute is located in Dharamsala, and that's in northern India. And Dharamsala is west of Tibet, close to China. And it's just over these color regions are the Himalayas, which separate Tibet from Dharamsala. And Tibet itself, the highest region on Earth, average elevation 16,000 feet, inhabited by humans at least 21,000 years ago. And it's home to many ethnic groups, with the dominant religion Tibetan Buddhism. The empire was unified in 604. In the mid-9th century, there was collapse of imperial Tibet with civil war, huge amount of history over the years. And then we get to the current times with the 14th Dalai Lama, Tenzin Gyatso, born July 6, 1935 in northeastern Tibet to a farming family. And he's been a leader of the Tibetans. And who is the Dalai Lama? Believed by Tibetan Buddhists to be the Bodhisattva of compassion and the patron saint or protector of Tibet, where he's a realized being inspired by the wish to attain complete enlightenment. And he's vowed to be reborn in the world to help all living beings. And the first Dalai Lama was in 1391. And these are the principal commitments from the Dalai Lama's website as a healing being, to advocate for cultivation of warm-heartedness and human values such as compassion, forgiveness, tolerance, contentment, and self-discipline. He's a Buddhist monk, and he encourages harmony among the world's religions. He's a Tibetan, and he's really the focus and leader and the focus of the Tibetan people's hope and trust. And living in India, he's focused on reviving awareness of the value of ancient Indian knowledge. And let's get to more modern times with the 14th Dalai Lama. Now, in 1913, there was independence declared without recognition by the Chinese Republican government. And then in 1950, it was incorporated into the People's Republic of China, but it was granted autonomy under this 14th Dalai Lama. And then, due to discontent in 1959, there was an uprising. The uprising failed, and the Tibetan government was abolished by the Chinese, and the Dalai Lama himself, with many people, escaped into exile to Dharamsala, northern India, where the Men-Tsee-Khang Institute is now. He's been very active throughout the world. He won a Nobel Peace Prize in 1989. He democratized the Tibetan administration in exile. And then in 2011, transferred his non-spiritual authority, because he was the governmental leader as well as a spiritual leader, but he transferred it to the democratically elected leader. And this ended a 368-year tradition of the Dalai Lama as both the spiritual and the non-spiritual leader. This was the case for the first 4 Dalai Lamas. And he's still very active. This is him just earlier last month teaching from his residence in Dharamsala to an international group. And this is a very important quote. So he's been a leader throughout his life, an inspiration to the Tibetan people. And this is a quote which really leads to this kind of collaboration. Tibetan medicine is far more advanced in the understanding of the nature of mind than Western medicine. In matters of understanding the physical functioning of the human body, Tibetan medicine is less advanced than Western medicine. And without mixing the two approaches and without saying one is better than the other, both schools should work together in order to find ways of understanding each other and thus boost the effectiveness of the two healing techniques. And this type of quote and feeling about such a leader has led to really a big effort for collaboration. For example, the Emory-Tibet Partnership, now called the Center for Contemplative Science and Compassion-Based Ethics. It was launched in 1998 to bring together Western scholastic tradition and Tibetan Buddhist mind and healing. And then this was at the invitation of the Dalai Lama himself to form this institute. And there's been a modern science curriculum, and it was implemented in 2014 with 345 students. And then just before the pandemic hit, there were 1,496 students in 2019. So this is a more far-reaching collaboration in science. And then for the medical portion, Raymond Shanatzi, who is the Emory director of Biochemical Pharmacology Lab, he's interested in isolating and testing antiviral and anti-cancer properties of chemicals from traditional Tibetan herbs. And this led to a request from Men-Tsee-Khang for assistance in developing a more comprehensive instruction in human physiology, anatomy, modern medical treatments, and research methodology to Tibetan medical students and doctors. And Dr. Shinazi and the Emory Tibet Partnership funded a teaching program directly at Men-Tsee-Khang, and it was launched in 2013. And 2018, which was the year I participated, this was then the 6th year of 2 weeks of instruction by Emory faculty at Men-Tsee-Khang in India. And this is a plaque at Men-Tsee-Khang Institute, and notice it was founded March 23rd, 1961 in Dharamsala. And the institute itself is part of thousands of years of tradition of Tibetan medicine. In 600s to 500s BC, the original Buddha, the historical Buddha, taught medicine. 348 to 468 AD, the Indian physicians, the Gages, visited Tibet, and the 28th king invited them to remain there and gave his daughter as a bride to Biji Gage, and their son was the first of a line of 4 generations of physicians to kings. And then Men-Tsee-Khang itself was founded in 1916 by the 13th Dalai Lama, who died in 1933. So this brought us then to this medical collaboration in 2018, and there were 4 faculty who spent time at Men-Tsee-Khang. We have Dr. Sperling and Sweeney, cardiologist and endocrinologist, who focused more on their specialties, and myself and Stefan Tigges, a radiologist. We were charged with teaching everything that they should know about the basics of anatomy and physiology in basically a week of sessions, both morning and afternoon, in a very intense program. And the classroom itself was filled with 50 students. It looks in many ways like a traditional classroom, except there were also banners, which we saw not only throughout the medical institute, but in many temples, and some statues with some traditional teaching aids. And you see again the banners, which were present in many locations. Everything was filmed for future use by the school. And when we stood in front of the classroom to teach, we used traditional aids like we'd use here. And here's Stefan teaching some anatomy. Stefan also brought MRIs and CTs, and he had all the students download them. They did all have their own laptops. And we went over a lot of those scans to give them a chance to go through anatomy, which was not part of their normal curriculum. And you notice we have a translator. Everything we said was translated. There were a variety of levels of fluency in English, including some who spoke no English. So everything throughout the course was translated. Now I'd like to discuss some principles of Tibetan medicine, which we learned. And we discussed with the physicians and had a chance to shadow some of the physicians in practice. There's 5 cosmophysical elements: earth, water, fire, air, and space. And each of those is involved in multiple parts of the body. And when we speak about these elements, when I hear these words like water and fire, these are what I think of, but they emphasize that these 5 cosmophysical elements are not static physical chemical elements, but dynamic forces that are characterized more by their inherent energetical function than their actual state. For instance, water does not mean a molecule of H2O, but its inherent energetic function to bring about a quality of heaviness, flexibility, and coolness. Key to Tibetan medicine are 3 principal energies. The diagnosis and a lot of the treatments are focused around identifying which of these 3 energies are the problem in the patient. And you notice each of these categories are very broad. Our lung is a manifestation of the air element and involves physical and mental activities, respiration, urination, defecation, development and delivery of the fetus, menstruation, spitting, burping, speech, clarity of the sense organs, sustaining life by acting as a medium between mind and body. Then we have M-Crispa, a manifestation of fire with hunger, thirst, digestion, and assimilation, promotes body heat, gives luster to body complexion, and provides courage and determination. And then Bodkan, manifestation of earth and water, involving firmness of the body, stability of the mind, induces sleep, connects bodily joints, and generates tolerance and lubricates the body. So you can see a complex combination involved in each of these three energies. And then hot and cold are also important, and there are relationships between these energies and hot and cold. For example, hot associated with fire, characteristic of M-Crispa, and cold characteristic of M-Arlung, and Bodkan is cold in nature. When we see the etiology of disease at the immediate level, certainly the first three are things that are common to Tibetan and Western medicine: diet and hygiene, lifestyle, seasonal variations. Something we don't consider are evil spirits, and their influence in Tibetan medicine is particularly indicated in cases where the patient fails to respond to sound diagnosis and treatment. Now, an important part of the Institute is the Body, Mind, and Life Department, and this department's involved in mental health, and this is where the Dalai Lama and the Tibetan physicians feel like they have the edge. And I can tell you, just in shadowing physicians, they have an incredible bedside manner and a close connection with their patients. It is very, very apparent. And this is a large part of their institute efforts in this area. And the spirituality and is evident. This is the Dalai Lama's home base. He lives on this compound, and just walking through, you can see monks, Buddhist monks all over the compound, and many of their meetings and services are open to the public for either observation or participation. And they can be quite large, and you see a large group of just people from the community who have joined in to these meetings and services. And I can only imagine what some of these meetings and services were like at the Potala Palace in Lhasa, Tibet, which is where the Dalai Lama lived before he escaped into India. For diagnosis, this is where there's significant variation from what we do. Now, the general categories are, of course, similar to Western medicine. Visual, their key components are tongue, and I didn't realize before I went there how big a role urinalysis played in Tibetan medicine. They spend a huge amount of time learning urinalysis, and I'm going to go through the urinalysis. So they were extremely interested in nephrology and urinalysis during my trip there. Also, touch. It's a very complex procedure, what they do for pulse reading, and then of course taking a history with interrogation. You know, they'll teach that interrogation is the most important clinical aspect of the entire diagnostic process, and the importance of this is certainly known in Western medicine. You hear many attendings say you can usually make the diagnosis just from the history, so this is well recognized. The tongue plays a special role. And again, a reddish, dry, and coarse tongue will categorize the disorders into the Arlong energy category, thick yellowish coating, M-Crispa, and a whitish sticky coating with dull, smooth, moist texture into the Bodkan energy disorders. The urinalysis, such a complex endeavor in Tibetan medicine, and they will teach that urinalysis is one of the most important diagnostic techniques in Tibetan medicine. And from an experienced physician can detect almost all disorders. Now, the night before Tibetan urinalysis, the patient must refrain from all these things: excessive tea, coffee, and fluids, buttermilk and excess sweets, wine, alcohol, beer, strong, spicy, and oily foods, sexual intercourse, insufficient sleep, strong physical emotions, mental emotional stress, vitamins, minerals, and medicines that alter urine color, which of course we would do too. And I don't think we place as many restrictions, well, we don't, on urinalysis, including on the physician. The physician who does the urinalysis should not have wine, alcohol, or beer, strong, spicy, and oily foods, insufficient sleep, strong physical exertions, or mental emotional stress. And so there were certainly plenty of opportunities during our trip that we probably should not have performed any urinalysis in Tibetan medicine on our trip. This is a street in Dharamsala, very busy and We walked all around, very, very active city. Some things, I know a lot of you have traveled all over the world, and these sites are very familiar to you. I usually don't see many of the animals that I saw in the city streets. Certainly in rural areas of the United States, you'll see cattle, but throughout the streets all over, we had these sites, a lot of monkeys, a lot of primates were seen throughout the streets of Dharamsala, and a lot of artistry and chance for late night shopping and to admire all the arts and crafts in Dharamsala. Now, the Tibetan urinalysis should be examined in daylight, not electric light, examined at 3 temperatures, warm, lukewarm, and cold. You look at just voided urine, and you look at the color, the steam, odors, and bubbles. For lukewarm, the sediments and scum, and then cooled urine, the time of changes, mode of changes, and post-change quality. And then, again, the energies, Arlung, Mkris-Pa, and Bodkan, are associated with various abnormalities. For example, color, when it's bluish like spring water versus yellow versus white, indicates different energies. The different categories of steam, unstable, thick and long lasting, light and quick disappearing, odor, smell of undigested food, foul or light, and bubbles large, tiny, or saliva like. Again, these different findings in urine point to these different energies, with each energy related to a very broad spectrum of problems in the human body. Time of change, from clear to turbid before disappearance of vapor, and from turbid to clear after disappearance of vapor. Hot versus cold, and also these modes of changes, transformation from the center bottom to top-like, and transformation from the edges to the center. And the post-change qualities, turbid versus clear, indicate hot versus cold disorders, which again are tied to these 3 energies. So you can see a tremendous amount of effort in learning this complex urinalysis. So there was great interest, and I had decided this before I really understand their devotion to the urinalysis. I brought dipsticks, and I had all the faculty and all the students take these home and take pictures of the key and do their own urinalysis and bring back the results. And I can tell you what I did find. I think you can see for urobilinogen. I mean, you'd be hard pressed to have someone without a validated lab tell the difference between 0.2 or 1 or even 2. But I think most could reliably tell the difference between whether they had an 8 or a completely normal urobilinogen. And in fact, there were a number who had both high bilirubin and a urobilinogen of 8. And so for anyone with abnormal disorders, I recommended, please go to a validated lab which can reproduce these results and get these checked out. So these may have been disorders involving the liver, for example, which had not been picked up previously. Of course, these were young students, and even here, many young students don't get comprehensive physical exams. Now, I went over tongue and urinalysis. The pulse reading is another very complex physical exam. And this is when I shadowed a physician. And when I saw her examine patients, she examined some external skin disorders. The other main physical exam that she performed was this. And notice she has both hands involved in a pulse exam. The other interesting thing was you notice that there's a person sitting behind the physician and the patient. And I thought, oh, this must be a friend or relative, but actually that was the next patient. And then I found the pattern throughout was the next patient simply sat in the room with the physician and patient and listened and watched. And that was true throughout the day, that the next patient got to see the previous patient's exam and hear the discussion. What were they doing with this pulse? They were examining much of the body. Here's the patient's left hand and the physician's right hand. And you see their index finger is examining the heart and the intestine and fire element. The middle finger is examining the spleen and stomach, and the ring finger is examining the left kidney and the reproductive organs, whereas the physician's left hand on the patient's right hand is examining the lungs and large intestine, gallbladder, liver, urinary bladder, and right kidney. And in fact, when I first arrived at Men-Tsee-Khang and met a physician, somehow it seemed a natural part of the exchange that they ended up examining me with this 3-pulse technique, and they asked me if I had any GI problems at the moment. And so this is still a very important part of the physical exam at Men-Tsee-Khang. Now, both the physician and patient must observe preliminary dietary and lifestyle restrictions for this pulse reading. During the exam, the doctor's respirations, body temperature, and pulse beat should be normal. Morning's the best time, and there's different pressure on with the different fingers. The index fingers press lightly, the middle fingers moderately to feel flesh, and the ring finger is pressed strongly to feel bone. And by the way, female, the organs that are read just below the index finger are switched. For example, the heart and the small intestine are read by the physician's left hand for women instead of the right hand for men. Lungs and large intestine by the physician's right. And this is because of the belief that channels through which mental consciousness moves in the heart are closer to the left side for men and the right for women. And it's not just examining the organs. There's also the family welfare pulse, the arrival of guest, harm from enemy, friend, evil spirits, substitution pulse, and pregnancy pulse, where, for example, the substitutional pulse is assessment of the condition of the patient who's not readily available for examining by examining a friend or close relative, examining their pulse. Once they find the disorder, how do they treat them? Same categories that we have: diet, behavior, external procedures, and pharmacology. Each of the different tastes are thought to either aggravate or pacify the energies in the broad categories. External procedures, massage. Now, part of the exchange was they offered us a massage, which I took them up on, and I can tell you it was the most incredible massage that I've had in my life. Oil all over my body, a very deep, hard massage, also very hot rods, which were put all along my spine to the feeling like it's almost burning, but didn't leave any marks. And I was told to leave the oil on the rest of the day to absorb the contents of the oils. And this is a big part of their therapy, these incredible massages: hot or cold compresses, mineral hot springs, medicinal steam, and then what they consider more drastic measures: bloodletting, suction or cupping, acupuncture, and also moxibustion, where they burn moxa made of ground mugwort leaves in various positions of the body. And surgery is only considered a last resort for any of the disorders. Now, they also have a pharmacology department right on site, which we got to tour. And they start from raw materials, collection of raw materials, processing those raw materials all the way to the final production of pills, which are distributed throughout India and internationally. And they have 150 different medicinal products produced on site, from the raw materials to the final medicines. And part of the exchange was very interesting, because I arrived there and I got up at 4 a.m. the next morning after 48 hours of flight, and Lapsang, a Tibetan physician, led Stefan and I on a drive and hike up the Himalayas to over 10,000 feet. And all along the way, Lapsang identified plants and told us the medicinal value. And in fact, an important part of the curriculum in the Tibetan Medical Institute is the students spend a couple months per year going up to the mountains and learning to identify and collect all these plants for medicinal use. How about therapeutics? An example for one energy, Bodhkan, which again is related to firmness of the body and stability of the mind. It induces sleep, connects bodily joints, generates tolerance, and lubricates the body. Foods recommended would be mutton, yak meat, carnivorous animals' meat, fish, honey, gruel from barley. Beverage would be curd and buttermilk from female yak, concentrated barley wine. Things that we'd agree with: regular exercise, living in warm and well-heated rooms. Specific taste: pungent, sour, and astringent. And there's 9 specific pills, powders, and emetics which are identified for treatment. And then the external treatments would be hot compresses on the stomach by heated salt wrapped in cloth, and moxibustion. So with this background of teaching to students who spent a lot of time learning the fundamentals of Tibetan medicine, what were some of our goals? And I asked the director, can I add a lot of pathophysiology into teaching basic anatomy and physiology? Because really what I wanted to leave the students with was an understanding that when they see a disorder, and what I wove through the curriculum was when they see someone come to them with, for example, shortness of breath, is the many body systems that can be involved. And as we know, could be the heart, could be the lungs, the kidneys could have led to volume overload and pulmonary congestion. It could be hematologic. It could be severe obesity, inability to move the diaphragm. It could be the neuromuscular junction with something like Eaton-Lambert. I wanted to leave them with an understanding for thinking about anatomy and physiology based on these presentations. And that was woven throughout the anatomy and physiology. And I based a lot of it on the traditional subspecialties of medicine, GI, cardiology, renal, hematology, oncology. And these were the focuses of the week-long lecture, which also ended with a comprehensive exam on anatomy and physiology. And we had a lot of time for one-on-one discussions and answering questions. The students were very enthused and incisive. And part of the program was at the end is not only learning anatomy and physiology, but a culture exchange with dance and music. So we saw many of the students perform, and actually the instructors, myself and Stefan, were required to perform for the group. So each of us, I actually teamed up with some students to sing. And so we performed a song. It's traditional to give some present, and I donated to their library primer on kidney diseases. And this is Namdal, the director of medical education at Men-Tsee-Khang. And they presented us with one of these banners, which I mentioned and showed. These were throughout the classrooms, and when I visited temples, many of them had these hung for various types of vocations and aspects of Tibetan culture, and they presented us one representing physicians. So it was an incredible experience to meet and exchange and learn from and teach both the Tibetan medical students and the Tibetan physicians. So in summary, it's really a very, very complex and rich history for Tibet and the Dalai Lama, which led to a partnership between two very different institutions, with traditional Tibetan medicine being taught in India as a result of exile, escape, a very knowledgeable and influential and caring leader, the Dalai Lama, who believed that we should exchange our expertise and to advance learning. But the fundamentals of Tibetan medicine have been around for thousands of years, and a lot of them are still taught at Men-Tsee-Khang. And interestingly, when I exchanged communications with Namdal to prepare for this talk, she mentioned, we're still using these traditional Tibetan medicine techniques, and we believe that they help for people with COVID. They are helpful for patients suffering from the symptoms of COVID, and they're being used in combination with other things by Western medicine. I want to give special thanks to Dr. Namdal Lama, who you saw me presenting the book with, the Director of Medical Education, Men-Tsee-Khang, both for hosting the exchange and for the reviewing of these slides on Tibetan medicine to make sure that they were accurate. Thank you.
Thanks so much, Steve. We have time for a couple of questions. I will ask one, Steve. What of what you learned there have you incorporated into your own clinical practice, if anything?
Well, I'll be honest. I haven't directly incorporated the traditional Men-Tsee-Khang principles into my practice, but I think, as we all do, when we see role models who have good bedside manner, who are caring for patients, that just adds to our combination of techniques on how do we connect with patients, and just the closeness to the patient. I think that's something that we try to teach the students. For example, not just standing at the bedside, but sitting on the bed, pulling up a chair and sitting down. And I think that's something which was emphasized certainly throughout my training, and I try to do, but that's something that's brought home when you see these Tibetan physicians work with the patients, and they are so close to them physically and interacting with them, and more conversation. And that just adds to my desire to do that here.
All right, thanks so much, Steve. Fascinating talk. With that, we will move on to our final speaker.